Hello, everyone, my name is Ji-Eun Lee. Today, we will discuss the differential diagnosis of joint effusion in patients who have undergone total knee arthroplasty. Case 1, Periprosthetic Infection. Let's consider our first patient. This patient presents with lamellated hyperintense synovitis on MRI. These findings indicate a high likelihood of periprosthetic joint infection, which is characterized by lamellated synovitis with a hyperintense signal, extracapsular soft tissue edema, extracapsular collections, and reactive lymphadenopathy. These MRI findings have shown high sensitivity and specificity for detecting TKA infections. Case 2, Particle-Induced Synovitis. Our second patient exhibits frond-like and hypertrophied synovitis on MR imaging, indicative of polyethylene wear-induced synovitis. This type of synovitis is characterized by synovial thickening with dense synovial proliferation and debris with low to intermediate signal intensity, similar to skeletal muscle, along with variable amounts of interspersed fluid and joint distension. Case 3, Hemarthrosis Nonspecific Synovitis. The third patient has a homogeneous effusion with high signal intensity on T1, weighted MRI, suggesting hemarthrosis. Hemarthrosis occurring late after TKA often shows hypervascular and proliferative synovium with signs of arthroplasty component impingement, making the synovium more prone to trauma and bleeding. Thank you for watching. If you found this video helpful, please remember to like it.